Hello, ladies and gentlemen. My name is Mark. I'm here to tell you my personal story of depression and anxiety. In my case, dysfunctional depression and anxiety. The reason I want to do this, or I'm passionate about doing this, is that I had a long journey to the point of where I got at this point in time, and I'd like to shorten yours. I go to a support group that saved my life. I run the group now, actually, at times. And the young people have always pulled on my heartstrings a little bit. So my goal here is to try to shorten your journey in an attempt by sharing mine and the wisdom I've learned. The number one goal I have is to change the definition of courage. I guess that's kind of a lofty goal. I'll go on to that. The second one is to nip this in the bud, and in that same vein of the first one, of changing that definition of courage, is to raise your hand, raise a flag, ask for help before self-medication occurs. And the third step, if those two were to work, or you were to believe in them and buy into them, is to lower this outrageously unacceptable suicide rate of young people. I've read in various places that between the ages of 14 and 24, between the ages of 15 and 21, that it's so close as the second leading cause of death of young people, right behind automobile accidents. And the suicide rate has jumped dramatically in the last 10 years. In my depression, I felt the two biggest things in retrospect that I felt was that I was totally alone in it, and I was totally at fault for it, which led to hopelessness and therefore suicidality on my part. You're not alone. They say a low estimate, and I've read there's different sources for these things, but 15% of our country, that's 50 million people, suffer from a mood disorder in the range of anxiety, depression, and bipolar disorder. So you're not alone in this. And the second biggest thing there is that you're not at fault for it. It's a real disease. It's a diagnosis that at some point in my story was comforting to know that it was a diagnosis, that I bought into the fact that this is real. It's not something that, as I started this off to say, that I was, the shame inside my own head, the stigma that I believed in a societal sense was that I was choosing this. The stages of recovery from anything are denial, anger, and acceptance. I think you've probably all heard that. I was certainly in denial, and I went back and forth to denial and acceptance, to denial and anger. I didn't think I was an angry guy, but I realized in opening up and talking about it that I held a lot of anger. I luckily came out the other side of this somewhat. I haven't arrived anyplace. It's certainly a journey. It's not a destination. Isn't the journey about self-acceptance, self-love, and finding out who you are? And for young people like yourselves, you want to fit in, you want to find your place in the world. And it's hard to be unique and stand out and be different, but it's worth it. It's so worth it. I heard a quote years ago that seems so trite and cliche, and you've all heard the first part of it, that be yourself. Great, be yourself. Thanks a lot, that doesn't help me much. But the second part of it makes it so much more powerful. Be yourself, everyone else is taken. So over these last years, to give you a perspective on my story, I had 6 hospitalizations for depression and anxiety over a 4.5-year period of time. But that was over 5.5 years ago now. And in recovery, you have to keep a bunch of stuff in mind. It's slow, it's patient. You can't choose to be Michael Jordan or Brad Pitt or Stephen Hawking. I'm never going to be that. But I can be a better Mark by 1 or 2% a month and be content with that, and slowly, patiently over time, build a full life again, which I have. I've led over 300 support groups at New York Presbyterian Psychiatric Hospital, Westchester Division in White Plains. I did a 2-year internship at the Mental Health Association of Westchester. I've talked before Mount Sinai Medical College to PhD MDs at a conference table who were listening to my story, and it was an unbelievable event. I did that 4 times. The people at the table it looked like a casting call for Freud, and they're listening to me. All the smartest people who academically are trying to do something about this illness that is so pervasive in our society. My comfort in myself was to say, if I could help one person by telling my story, which is painful, and I don't carry an onion in my pocket, and I sometimes choke up, and I hope to make you laugh a little bit along the way, but it's my story. But I thought I could do this, I will do this, if one person might get help from what I say, and their journey might be shortened, or their child's journey. And well, I've gotten to the point where I need to do more. I want to be an ambassador for change. You know, in my lifetime, I'm 62 years old. The LGBTQ movement has come so far in acceptance, and AA and NA have become somewhat acceptable thanks to people like Betty Ford and Kitty Dukakis. Celebrities get on the cover of People magazine if they go to rehab. But when you go to a psychiatric hospital, when you're dealing with depression and anxiety in a lockdown ward, people are scared to come see you. They view it almost like it's contagious. You know, it's not contagious, neither is homelessness, but a lot of people cross the street. They talk about life as, my maternal grandmother used to say it, I'm sure it's not her line, this ain't no dress rehearsal. This is the only chance we get to go through life. This is the show. You know, you gotta do the best you can. And it's meaningful. It's meaningful to show up for life. It's kind of the first rule. So anyway, to get to the point here, I want to redefine courage. When I say that, a lot of people get terrible advice from like my father, man up. What does that mean, man up? It comes from the expression, be a man and buck up. And kind of, excuse my language, and shut up. And just go back to college, go back to your dorm, and do what all the other people are doing, all the men are doing, all the ladies are doing, all the young women are doing, you know, which is often self-medicating and hiding your pain. And when I say redefine courage, I just mean, you know, to raise your hand, to raise the flag, to ask for help when you need it. Don't be quiet about it. It's not a shameful thing. The first thing I had to conquer when I think about shame and stigma and trying to be an ambassador for change, the first shame I had to conquer was my inner shame. And to do that, I came up with a line that says, you know, you have to participate fully in your own recovery. So therefore you have to do it yourself, but you don't have to do it by yourself. You have to raise a hand, and if that means break down crying to a friend, to a counselor at school, to a trusted parent, to a sibling, whoever that is, I've come to believe in 100% that when you share your pain, when you share your struggle, when you share your story, and you open up about things, that doesn't, the pain doesn't escalate, it dissipates. It gives it space to go. And that's a good thing, you know. And the different dynamic, maybe at first you'll be convinced to see a pharmacologist, and maybe medication will help. It certainly is part of the solution, you know. And maybe talk to a therapist on one-on-one. That's a really helpful thing. But in a group setting, it's a different dynamic where you share it with sort of fellow travelers, other people who have lived the experience, and it's not that doctor-patient relationship. It's an equal relationship, and even that is different and empowering for you. And that's what I hope to do, is empower you. My second thing, if you can redefine courage and open up and not be quiet and not self-medicate, that's that second phase. If you can believe that you can open up and do that, and the second phase is before you self-medicate. I think we all know whether the first time we drank too much alcohol or smoked a joint, or God forbid used harder drugs or used a needle. I don't think those last things going to come into play in this part, but you know, some of it can be fun and social and growing up, and your parents don't want you to do it, and you're going to do it. And if it's fun and you go to a couple of parties, okay, that's can lead to separate issues. But the first time you do it, whether you're 16 or 19 or 24 or 42 or my age, and you do it to ease the pain, you know the difference. You know it's not to be social, it's not to be fun or cool or because there's a party going on. If you're doing it to ease your pain, don't do it. Raise your hand before you do it. Because all you're doing is creating a secondary problem. And the third thing that this all leads to is, as I said earlier, is the idea of suicidal thoughts, of suicidality. It's amazing to me now that I've studied this and learned this and worked it and lived it for 4.5, 5 years, and now I've been on a road to recovery for pushing 6 years, that there are so many phases of this. There's suicidality, there's passive suicidality, there's, are you having suicidal ideations? Do you have a plan? There's steps to it that there shouldn't be. It shouldn't even be a thought that we would take our own lives. And I'm not judging it. I don't want to condemn it. I just, they say that it's a permanent solution to a temporary problem. When I was in the pain I was in, when I had suicidal ideations and somewhat thoughts and attempts a little bit, I didn't think it was a temporary problem. I really thought, as do many people, that they had exhausted all the possibilities and this was all that's left. And I'm here to tell you it's not. It's not. What leads to that is that feeling of unworthiness and the fact that you're not perfect enough. Neither are true. You are worthy, you are enough. Perfection is the enemy of good enough. Try to hold on to those thoughts. You're a unique person. Since I'm addressing young people, I'm such a firm believer, like in Martin Luther King, keep hope alive. You guys are the future of our beautiful, wonderful, global planet. And if you give up, where are we going? You are the loving, empathic, creative geniuses of the future. I have a 16-year-old daughter, soon to be 16, named Lily. By far, she's my greatest pride. Also, one of my greatest tools of recovery, because one of the symptoms of recovery is self-absorption. You lose perspective. And now I can see that loving something more than yourself when you have a child is one of the great tools in behavioral therapy that they say will help over time, collectively. I say I did it myself. I knew when I needed help and who to ask for it and who to allow in. And that's one of the things I am imploring you to do. When you're down, when you're scared, and I was frightened. They talk about depression as sadness. My depression, I was way more scared than I was sad. And this isn't your fault, Would you feel bad about yourself? Would you hide if you had diabetes, if you got cancer, if you had some kind of other physical illness? But we hide out with this stuff, So I would love you guys to listen to what I have to say. And I know when I got to the point where I started to cross that threshold of hope again, I needed to hear these kind of words like 9,000 times a day from 900 different sources. There was so much wasted mental space taken up in what people thought of me. And with that being gone, or in its best place ever, I have so much more clarity of mind, so much better memory, so much more hope. And I want to impart all of that on you. So remember, look at the view. Thanks for your time.